What's up, guys? We've done 3 reviews of The Good Doctor already, but we haven't even seen season 2 yet, so let's start it up. Season 2, episode 1. Dr. Sean, I'm coming for you.
The patient has pulmonary hypertension. The only treatment is medication, which reduces the lung blood pressure, but not enough. Her heart's failing due to the extra strain.
So pulmonary hypertension is exactly what it sounds like. Pulmonary meaning lungs, hypertension meaning high blood pressure. But it gets really tricky when you have high blood pressure within the lungs, because then it puts a lot of strain on your heart to be able to beat against that pressure within the lungs. Oftentimes, once medication fails, the last approach becomes surgical intervention, which is what I expect to happen here. When I say surgical intervention, it means a transplant.
What about a fix?
Isn't it just a transplant?
Nope. There's nothing inherently wrong with Melanie's heart. It's healthy. Just needs a little bit of help. So we're gonna leave her current heart inside and slot in another one to support it.
Well, it's still a transplant. You tricked us, man. I obviously don't take surgical cases like this. This is outside of my wheelhouse, but it is interesting to hear that this is even a possibility. You can have 2 hearts beating simultaneously to give it a little bit extra support. You probably would have to be on blood thinning medication, immunosuppressive medication, because you have more turbulent blood flow. You have another organ inside of you that your body will probably react to unless you have immunosuppressive medication on board. I can see a huge challenge coming up here.
Do you live in a tent? Yeah. I lived in a tent too. It wasn't very good, so I moved to a bus. You should move to a bus. You will be much less likely to develop ulcerative tinea pedis.
Tinea pedis, or pedis as he says it, is a fungal infection of the feet. When it becomes very severe, you can have ulcerative fungal infection, where you actually have breakages in the skin and you can get infections on top of the fungal infection you already have present. It's basically like the worst form of athlete's foot. Treatment for this usually requires oral antifungal medication because topical would not have enough strength to cover it.
Just keep it dry and clean and we'll give you some.
Would you rather we continue to discuss this inside? We are discussing things with the patient that are potentially sensitive.
We're done with the patient.
He's actually really right here, even though the fact he's usually bad at picking up social cues. You should not talk about sensitive issues in front of other people with a patient like this. Even if it's as simple as putting up 2 little curtains to give them some privacy, or at least a sense of privacy, will make the conversation go a lot smoother and allow the patient to take in the information without feeling like all eyes on them. Good job, Sean.
Excuse me, please. Excuse me, please.
Thank you for keeping me waiting.
We doctors are busy, important people.
Hold on a second. Is that Dr. Cuddy from House? Is this like a crossover event that's happening right now?
Look, Dr. Blaze, I am like any other patient, entitled to have a say in my own treatment, but unlike any other patient, I have spent my entire adult life digging into people's brains, so if you think I'm gonna sit around and watch, you're mistaken.
Well, if you think you can operate on yourself, I'd happily add you to the list of potential surgeons. Today, you're going to be waiting. And waiting. And waiting. Test, test, test. You've had them all before. I want them again. My versions.
It's actually really important what she's doing here is that she's not letting herself be bullied into making medical decisions based on just what he wants. She's letting her own clinical experience, her knowledge guide her to make the best decisions for his health. Very often this happens when you have a powerful patient, a VIP patient, someone very wealthy, that they say, oh, I want the absolute best care, I want all the tests, when in reality, that's not in their best interest. And it takes someone with a lot of guts to stand up to that. So I applaud Dr. Blaze / Dr. Cuddy.
What's your name?
I'm Harry. These are my meds. Those pills are for people with chlamydia, Harry.
Oh, you're all the same. See, I know better. That's why I had to hide out in the streets. I had to move next door to Mr. Googly Eyes. I trust him. He's my friend.
Why are doctors involved in this and not security staff? Like, if I'm going to any kind of event, they usually bring security with us because there's a lot of medical equipment here, there's medications. Why are the doctors getting involved? Come on, show, get some diesel security dudes and gals up in there just
I trust him.
Okay. Disorganized thinking, paranoia, and delusions. I think you have schizophrenia, Harry.
Okay, this is my first time I'm gonna call BS on Dr. Sean. As a surgeon, perhaps he can look at someone and figure out the problem right away because it's a problem of plumbing, anatomy, what have you. He can look at a scan. You can't treat humans with mental issues like that. Say this patient is just high on methamphetamine and he's having all of this disorganized, psychotic thinking. Is it schizophrenia? No, it's not. So Dr. Sean, pump those brakes and let a non-surgical doctor take over here. That's an abscess.
That smells very bad.
So the reason why abscesses smell bad is because you have an infection that already smells bad, but then you have all these inflammatory cells that go in to fight off the infection, and what your body does is it walls off that infection and essentially creates a bubble of pus. And pus never smells good because of the dead bacteria. The only treatment, IND, incision and drainage. Cut that bad boy open, let it drain out, get the infection out, and then you could start thinking about antibiotics and all that. But you have to drain it. Being happy and healthy.